a few more joining us, and we'll get to them when they get on. But I wanted to start by saying welcome, and these press briefings that we've been doing every week seem to be a success, and it's a good way for us to get information out. Today, I want to talk a little bit about additional ways that residents can sign up to get vaccine. So we have been emphasizing to everyone that they should contact their doctor first to get on the list for their doctor. The doctors certainly know their underlying health conditions. They know their health history. They can provide some consultation about if the vaccine is appropriate for them and when they should receive the vaccine. And we definitely continue to stress that. If someone does not have a physician, we have been saying that they need to get on the list here at the health department through our website or through calling. Right now, calling is the best option, but we will be adding some website options, and we would certainly still encourage that. The third option is for residents to register for the Missouri's Vaccine Navigator. I'm going to share my screen now. So through the Vaccine Navigator site, you can go to covidvaccine.mo.gov here at the top of my screen, and then you can click Register Now. And again, you click Register Now, and it walks you through the steps of registering for the Vaccine Navigator. The Vaccine Navigator will be an important tool if you don't mind going to a mass vaccination event. If you are willing to drive a little ways, you will be able to see all the ones that are in the region. It will determine your eligibility. So if you're not in the tier that is open now, you can go ahead and register. And then when your tier is open, you will be notified, and you will be notified of events in your region that you can register for. And it's also important to note that if you don't have internet access and cannot access this site, you can call the hotline, the COVID hotline at 877-435-8411. So it's a very important tool to be able to access if you don't mind, going to a mass vaccination event. If you can't necessarily get it through your doctor, or can't get on the list at the health department, or you just don't mind driving to a mass vaccination event to receive that vaccine, it's another option for you, and you'll be notified of those events in your area. We would ask that if you have registered with multiple providers, we know a lot of people have done that. If you get the vaccine elsewhere, we would appreciate being notified. I know the health department would, and I'm sure the other providers would too, because it takes a lot of unnecessary staff time for us to call individuals to schedule an appointment only to find out that they've received the vaccine elsewhere. So I would encourage everyone that if they did receive the vaccine elsewhere through a mass vaccination event or another provider, to let everyone they know that they have registered with. So that's all I had for my report today. I think we'll go to Dr. Haight at Cap Region Medical Center.
Hello, everyone. Hopefully we'll be having warmer weather soon, which will help us all. But wanted to talk a little bit about the vaccination events that many of you have gone to or will be going to. We have had a great time vaccinating people. I'm sure all of us can say that, who are healthcare workers, being able to provide the vaccine. But we do have a few instances that come up, and so I wanted to share what you should do. So there are some patients who before their first shot or between their first or second shot have been exposed to COVID and are under quarantine. So it is important that you not come to an event if you are quarantined or have that known exposure. That puts other people at risk. And so what we ask you to do is to reach out to whoever gave you the vaccine. For example, if it's Capital Region, you would call us, or the county health department, you would call them and let them know what's going on. And oftentimes we are able to reschedule or put you into another group that we have coming up to get the vaccine. Also, we've had instances in which patients are in the hospital currently, or maybe have been transitioned to a nursing home for one reason or another. Again, it's important to work with the institution that vaccinated you, as well as if you're in a hospital or nursing home or other environment in which there is a physician who's looking over your care, that is discussed about when is the best timing for your vaccination. Again, I think we're all committed to getting people vaccinated, but we want to make sure that the vaccine is safe for you at the time that you're receiving it. It is also important to remember with the vaccines that if you received the Pfizer for your first vaccine, your second vaccine should also be Pfizer. In the same way, if your first vaccine is Moderna, your second shot should be Moderna as well. And most of the time, you're able to do that at the same institution you're started out with. Again, each of us will work with individual patients with individual circumstances to make sure that you can get the shot when it is available and it is safe for you to do so. One other thing I wanted to mention, just because I see patients and I get patient calls, and this was about some news articles about mammography. And so the Society of Breast Imaging made this statement. They say, if possible, and when it does not unduly delay care, consider scheduling screening exams prior to the first dose of COVID-19 vaccination or 4 to 6 weeks following the second dose of a COVID-19 vaccination. The reason why they say that is sometimes after a vaccine, people may have a little bit of adenopathy, or that is swelling of the lymph nodes in the armpit area, which mammography sometimes will pick up those lymph nodes. And so then it will show as an abnormal mammogram. And so we don't want people to be scared, but we also want people to realize it's actually a low percentage of women who will have that abnormality. So first and foremost, if you are planning on delaying a screening mammography, please contact the ordering physician to make sure that you've had a discussion with them and make sure that you are in agreement. Secondly, this statement only applies to screening. So if you have an abnormal mammogram already, you're getting what's called a diagnostic mammogram, you have an abnormal study that's being followed, you have a finding on exam that your physician or provider is following up on, you have known breast cancer, please do not delay. The statement they made is only for those screening mammograms. And again, you should have that discussion with your physician. I know the radiologists in town, both at JCMG, St. Mary's Capital Region, are looking at these guidelines. And if there is an abnormality found and it is around a vaccination, then they will likely want you to be followed up with your physician or provider, and they may want to do a follow-up ultrasound just to verify that that finding is no longer there. But again, I just wanted to state that because I have been getting questions over the last few days within my clinic with my patients. Thank you.
Thank you, Dr. Haidt. That was great information. JCMG, Ron.
Good morning. Wanted to talk briefly about a couple of questions we're receiving in regards to taking medications prior to receiving your COVID vaccination. So a common question we get is, should I take Tylenol or Motrin, prior to my vaccine dose? We know that COVID vaccines, come with some side effects, which is of course a sign that your immune system is getting to work as mounting protection of the virus, and those common side effects can include pain and swelling in your arm where you receive the injection, as well as flu-like symptoms that include fatigue, headache, fever, and chills. Taking over-the-counter pain medications such as aspirin, acetaminophen, also known as Tylenol, or ibuprofen, also known as Motrin or Advil, prior to your vaccine is actually not recommended by the CDC because it's not clear how taking these medications before your shot can affect the vaccine's effectiveness. The concern is taking these medications prior to receiving a vaccine may actually reduce its ability to work and could dampen your immune system response. I want to be clear, if you do take aspirin, acetaminophen, or ibuprofen for other medical conditions, you want to continue to do so as directed by your physician. Otherwise, you really shouldn't pre-medicate. If you do experience side effects after getting vaccinated for the COVID-19 virus, CDC indicates you can take over-the-counter pain medications such as acetaminophen, aspirin, and ibuprofen. Of course, with all medications, you should check with your physician first before doing so. Side effects in which you'd also want to reach out to your doctor would include any localized redness or tenderness in the arm where you receive the injection that gets worse 24 hours or increases afterwards, or if you have side effects that are seeming to be worrisome or bothersome or don't seem to be going away after a few days. Thank you.
Thank you, Ron. Dr. Sullivan with the Community Health Center of Central Missouri.
Good morning. We did have Community Health Center had 2 events this week, vaccine events that we did have to reschedule because of the weather. We also had to cancel our free COVID community testing that was scheduled for yesterday. We are working to get those events rescheduled. One of those events was with the Housing Authority, and we were going to do vaccinations at 2 of the apartments for senior housing. And so we are rescheduling those to next week so we can make sure we get those individuals that may have trouble getting to our other events. We'll get them vaccinated at their apartments. In addition, we're reaching out to other United Way agencies in our region to try and help facilitate getting those vaccines to the underserved community that may have some barriers to getting to our events that we have in our clinics. And I just wanted to reiterate what I mentioned last week about transportation. We know that transportation is sometimes a challenge for people. If you are having trouble finding transportation and you're unable to reach out to your friends, family, or church, Oates Transportation Oates Transit is providing free transportation if you're 60 and older or if you have a disability. So that is an option. If you have Medicaid or managed Medicaid, they do provide transportation to your appointments. Typically, they require 72 hours advance notice. So just make sure you're getting that transportation set up well in advance. And then we are also continuing to provide some education related to the COVID vaccine to those that are in those underserved communities as well. So that's all that I had for this morning.
Thank you, Dr. Sullivan. Dr. Adams with SSM.
Good morning. I wanted to talk about anosmia, which is the loss of smell that occurs in about 80% of patients who have had an active COVID infection. While the majority of patients regain their smell after a month, there is about 25% of patients who continue to have a loss of smell for even up to 60 days. And as you can imagine, that could lead to some food and safety issues in your home. So if this applies to you, consider if you have gas appliances, getting your natural gas appliances serviced on a regular basis, or getting a natural gas detector in your home. When it comes to fire and smoke, you may even want to consider checking your smoke alarms weekly. When it comes to food products that may have gone bad, your smell is one of your first warning signs when it comes to food turning bad. So make sure you're checking the dates on your food and have people in the house smell your food for you before you eat it. And then finally, when it comes to chemical cleaning products, make sure that you're in a well-ventilated area when you use those products, because as they build up, you might not notice that the smell is getting so strong. So all some things to consider when it comes to having a loss of your smell. Thanks.
Thank you, Dr. Adams. That was great information. Great information from all our guests today. Sam, from the county perspective.
Yeah, I'm just going to talk a little bit. We've got our second vaccination clinic coming up Friday, February 26th. And it is just for those who were at our first one. It's not for new patients who want to be vaccinated. This is the second dose of the Pfizer for those who were at our first one on the 5th. So I just would like to ask everybody who's coming, print off that white registration sheet again that you filled out on the 5th and fill it out again, and it will expedite getting through the line, and you can be in and out there even quicker than you were at our first clinic. So, and it's supposed to be in the 40s next week, so it'll be a nice day to come get your second dose.
Thanks, Sam. And yeah, just a reminder that will be at the link again. And those that were vaccinated on the 5th need to bring back their white vaccination card so they can receive the second sticker for their second dose. And those that were there on the 5th will be receiving a return phone call from our partners at Central Bank again to remind them of their appointment time and to remind them to bring the necessary paperwork. Mayor Turgeon from the City of Jefferson.
Thank you. And there's so much valuable information that is given on our weekly press briefings. So these are recorded, and then every Thursday afternoon after they've been recorded, they are uploaded onto the City of Jefferson, Missouri Facebook page. So if you're not already following that, I would encourage you to share these press briefings as much as you can, because there is so much information on here that we need to get out to the public. We appreciate our media partners. They've been running a lot of stories based on these weekly press briefings, but we also encourage people to share these briefings with their family and friends and coworkers. So again, it's shared every afternoon after our press briefing on the city's Facebook page, and I'm sure the county is getting that out as well. So just share this information as much as you can. It's valuable. Please listen to the doctors and health experts that are on the call, and continue to take the precautions and continue to have patience as people are working through the pandemic and working through getting their vaccine, which will take some time. So we just continue to urge our citizens to follow the precautions they've been doing this whole time. And now I'll turn it over to Chief Schofield.
Well, thank you, Madam Mayor. And I just wanted to just take a brief moment to just let folks know that, you know, when we're dealing with extreme temperatures like this, some of the symptoms that we commonly associate with COVID symptoms could also be similar in nature to what we see with carbon monoxide poisoning. And we just want folks to make sure they're taking all the necessary precautions to recognize those symptoms. You know, some of those being dizziness, lightheadedness, headaches, nausea, vomiting, general fatigue, and ultimately unconsciousness. And so we would just tell folks to keep an eye on those types of symptoms, not just from a COVID perspective, but also from a carbon monoxide poisoning perspective, especially when we have extreme temperatures like this, when we're dealing with a lot of folks who are leaving cars idling or spending a lot of time in their vehicles. Anytime you have a car running inside of a structure, that's a concern. It's not well ventilated. Also, any type of heating appliance that might be malfunctioning, whether that be a fireplace or space heater or normal furnace, make sure those things are well vented. And just general safety precautions during extreme weather, just to kind of keep an extra bit of vigilance out there during this time.
Thank you, Chief Schofield. That's really good information as well. So at this time, I would open it up for questions unless there's anything else to be shared by the speakers.
Hi, this is Jessica with KRCG 13. I just had a couple questions about some of those vaccination lists that everyone had. I was just curious, how many people are currently on like the health department and SSM and JCMG and Capital Region? How many people do you have on your list? And then of that list, how many people have received at least their first dose of the vaccine?
So speaking for the health department, I know at one time we had close to 8,000 on our list. And with the event that we had at the link, everyone that was over 65 was called. And we found that close to 2,000 of them had already received vaccine somewhere else. And then about 2,000 people were registered for the event at the link. So we've been whittling down our list. I don't have the exact number right now, but I know that and we've been calling, to schedule appointments here. So our list has been getting smaller at the health department, but I'll let the other organizations speak for their list as well.
So at Capital Region, we currently have 2,000 to 3,000 on our list. And again, this list only contains those patients who meet the tier that we're in and who have made contact with us. As we're finding patients coming in for their routine appointments, we are asking and then we're adding them to the list as well. So we continue to add patients as they're coming in. And again, we still have a large number of patients who've already made contact and who have not been received a vaccine yet.
JCMG perspective. Oh, Dr. Adams, go ahead.
At SSM, we have over 1,000 patients on our list. And what we've noticed is as we vaccinate, people just continue to call in and get back on the list. So our list doesn't really seem to really go down that much.
So at JCMG, we've started with roughly 8,000 patients on our list, very similar to Capital Region for patients that meet the current criteria. We vaccinated approximately 40% of those patients at this point. So we still have several thousand more patients that we're reaching out to. I'd like to again stress what Christy mentioned earlier. If you have received the vaccine elsewhere, please do let us know. It is taking a substantial amount of time to run through these lists, and when we call patients, we're ecstatic to hear that they did receive the vaccine elsewhere. It's just that at this point there is a lot of redundancy that's occurring when calling patients, and we could expedite those calls if we know that you have received that vaccine somewhere else.
Awesome. Thank you, everyone. And then with the delays in some of the vaccines due to the weather, is there any concern about some of the follow-up appointments for people to get their vaccine next week at all?
So in our regional meeting, we did discuss that. I think a lot of the distributions this past week were affected, and fortunate or unfortunate, Capital Region and St. Mary's are a high throughput vaccine receiver. Our doses actually don't come in this week, they come in next week. And we expect that supply to come in, and so we're preparing for such. But we do know that FAMU, they were supposed to receive their vaccine and it has been delayed. So it has caused some difficulty for those first shots. For the second doses that we've been giving last week and this week, we were not affected because we had already received those second doses, and we are still planning on having our events as we had scheduled.
Same for the health department. We were able to give the second dose vaccines as scheduled. And then on the regional perspective, as the regional implementation team, there was an event scheduled for Morgan County, but it was pushed to next week. And the Audrain County second dose event, there is a little wiggle room with that second dose. It's also been pushed to next week. And as Sam mentioned, the weather for next week is looking great. So there shouldn't be any issue with our second dose event on the 26th.
Okay. And then I know the governor in his press release earlier this week said that some local health agencies were going to be getting some of the vaccines from the mass vaccination clinics. Did anyone in kind of our area get any additional vaccines?
In Region F, the only event was scheduled was Morgan County Health Department, and they already had the vaccine on hand. And because they pushed it out just a few days, they were able to keep that vaccine and not redistribute it to other health departments. So in Region F, there wasn't redistributed.
Okay, gotcha. Thank you. And then one more quick question for me, just because we've gotten actually a few calls this week about the first and second dose of the vaccine. Just kind of wanted to confirm with you guys that both doses are the same. They're the exact same chemically, correct?
Correct. All the doctors are shaking their heads. Jessica, I don't know if you have your camera on, but yes, they're all in agreement.
Okay, good. That's what we were thinking, but we just, for whatever reason, we've gotten a good amount of calls about that for whatever reason. So thank you for confirming that.
Thank you for helping us get out good information and dispel some of that misinformation and questions that are out there. We appreciate all of our media partners participating in this and relaying the good information out to the citizens. So are there any other questions? Well, hearing none, I guess we will end the press briefing for this week, and we'll plan another one next week. Okay. Thanks, everyone. Stay warm.